Ontario confirmed today that it has asked Ottawa for help. The province is battling a third wave of COVID-19. There are more people in hospital right now than at any other point during the pandemic. Intensive care units in Ontario's hotspots are packed beyond capacity with seriously ill patients. Let's bring in the CBC's Hannah Thibodeau in Ottawa and Megan Fitzpatrick in Toronto. Megan, let's begin with Ontario's request for help.
Well, Carol, it's now official. We know these talks have been going on kind of behind the scenes for quite some time, but we have now learned from Sylvia Jones, the Solicitor General's office, that a formal request has been made. They've been having these talks about health human resources and those who work for the federal government and how they could be deployed here in Ontario. And Jones's office saying they have now identified those people, Carol, and formally requested their help. But in addition to that, they're saying they have also requested logistical and operational support. This is from the Canadian Armed Forces as well as the Red Cross. What that logistical and operational support will look like exactly, we're not sure yet. But Sylvia Jones did speak about this a little bit earlier. Here's some of what she said. Oh, we don't have the clip. Sorry about that. Okay. So she was saying some of the staff they've requested are focused on critical care. So health practitioners that can help with the crisis that we're seeing in Ontario's hospitals right now, Carol. This request, though, just to point out, like I said, had been in the works for a while. Prime Minister Justin Trudeau and the federal government had talked quite some time ago about how they could help Ontario. And at that time, that included mobile vaccination teams. And at that time, the Ford government essentially said, no, thanks. All we want from you, from Ottawa, is more vaccine. But things have changed since then, and they are now requesting this help. And the opposition parties at Queen's Park today, well, they were saying it was about time that Premier Doug Ford should have asked for this help weeks ago, and that the government's lacking a sense of urgency. But that's what we know for now, and we're still waiting for more details on exactly what this help will look like.
All right, Hannah Thibodeau is standing by, and she has details on the resources that could be provided here. Hannah.
Yeah, let's remember the last time that the military helped out in Ontario was with long-term care homes. That was from last April until July. We don't know for sure, as Megan says, exactly what will be provided. But last time around, it was nurses, medical technicians, as well as specialized people. These people will go in to help in the ICUs. We heard that from the Solicitor General today, that they need to have some relief in there, that they are overwhelmed. And as Megan was saying today, this request has taken some time. The process it has to go through is it has to go to public safety, then it goes to the Department of National Defence, and then it goes to the Canadian Armed Forces, where they will eventually leave from. Now, last time around, that was from Petawawa. Again, this time around, it makes sense that whoever is assigned to this will come from Petawawa. That's because they have the 2 field ambulance there, and they would have these type of staff to help out in this type of situation. So expect it to be from Petawawa again. And right now, what's likely happening is they're in the location doing a recce, trying to find a location where the staff can stay. Also, you know, how they can get food and those types of things. But here's another tidbit to know is that in Petawawa, 2 Fridays ago, they started vaccinating their troops, and they were doing quite a few. So the vaccinations will have had 1 vaccination, and they're now into that 2-week period where it starts to take effect as well. So these troops are likely to be vaccinated. They're likely to be there pretty soon. And again, it's supposed they'll likely come from Petawawa as well.
All right, Megan, this comes on a day where help is on the way from Newfoundland. What do we know about that?
We know, Carol, that it'll be a team of 9 people that includes Dr. Alison Fury, whose husband is the Premier of Newfoundland and Labrador. It will include 6 nurses and 3 doctors. Christine Elliott, the Health Minister's office, saying that they want to thank the courageous volunteers and the province of Newfoundland and Labrador for helping Ontario manage the 3rd wave, and that their selflessness is nothing short of remarkable and heroic, it says in this statement. We know, Carol, they'll land here in Ontario tomorrow, and they will be working at the University Health Network in downtown Toronto. They'll spend some time tomorrow getting oriented and up to speed, and then they'll be put to work on Wednesday, I'm told, and they will help care for patients and help alleviate some of the exhausted staff working at that hospital.
All right. Thank you both very much. Hannah Thibodeau in Yarmouth, Nova Scotia, and Megan Fitzpatrick here in Toronto.